Good day and welcome to Massage Matters. I'm your host, Chris O'Connor. Massage Matters is designed to give you a hands-on look at the various manual therapies that are available to help you heal your mind, body, and spirit. Massage Matters strives to raise the awareness of these therapies within our community. My hope is that by explaining and demonstrating them, those of you watching will put them to use, encouraging you to become more involved with your health care. Each week features a specific technique, and in some cases we'll bring in an expert guest to teach us what we need to know. Some of these therapies you may be very familiar with, but I'm sure there are some that will be completely new to you. After we've demonstrated these techniques, you'll be better equipped to decide which treatment is best for you. Today's show will be all about Shiatsu Therapy. We have in the studio today my special guest, Nir Saar. He's going to go over what Shiatsu Therapy is, some of the reasons people choose Shiatsu and conditions he treats. A little later on, we'll be at the table with Nir and a volunteer to show you what a Shiatsu treatment looks like. I'm ready and I hope you are too, so let's get started. Welcome to the show, Nir. I'm very glad to have you here.
Thank you for having me, Chris.
Maybe just give us a little bit of background about yourself from a professional standpoint.
All right, so I started with Shiatsu massage around 7 years ago and studied the Zen Shiatsu, which is the Meridian Shiatsu. And then I did some postgraduate program for Shinso Shiatsu, which means the word Shinso in Japanese means deeper. And then I've studied the TCM, Chinese medicine and acupuncture, and I studied the Japanese style acupuncture, and I also did some craniosacral courses.
Wow.
So I try to combine all of these together to get the most effective treatment I'm able to give, and also it's good because you get different angles of what's going on with the patient.
Right, well, so sort of a full, sort of well-rounded sort of approach to things. That seems to be the way it's going in healthcare these days. Could you just tell us a bit more maybe about Shiatsu today, as I know that you do a couple different types and there's a couple different philosophies, so maybe if you could just give us a little rundown.
For sure. So Shiatsu, I would say, started as a traditional massage in Japan. It's deriving from, actually originally from China, as same for Chinese medicine, as over China, and then Japanese embrace that. So no offense for the Japanese, of course.
No, of course not.
Yeah, but they make good cars.
Yes.
So originally it was Anpuku and Anma, which were two different modalities. Anpuku worked more on the abdomen, diagnosing and treating through the abdomen, which makes sense because all the internal organs are here. And Anma was a more invigorating treatment that worked at the whole body. And it's a little bit like the Chinese Tuina. And then there were some, after in the 50s, after the Second World War, the Japanese embraced Western medicine. And so they only allowed the blinds to practice the Asian medicine.
Right.
So actually the blinds were the keepers of the tradition.
Okay.
And then there was some regulatory changes. And so a new modality was formed. It was called Shiatsu, which means finger pressure.
Okay.
And then it started to develop. So Shiatsu is a physical treatment, but it is also an energy treatment.
Right.
Because you, like in martial arts, you use your dantian, your hara, which is big in Asian cultures, and you use your intention and use the meridian systems. So meridian systems are energy channels that go through the body. And there, in Chinese medicine, there's a way to diagnose these meridians and treat them with acupuncture. But you can also do it with palpation. You can do it through the abdomen or through the back or through the pulse and through questioning the patient. So the Shiatsu treatment will be diagnosing through the abdomen mostly.
Okay.
And then treating the meridians that flow on the legs and the arms in order to affect the abdomen and in order to affect the whole body.
Right. So what typical, what's the sort of thing that people typically come in to get treated with Shiatsu therapy?
So, of course, all the alternative modalities, I think that people will come mostly for stress and for pain. That's the main things, because those are things that people are having really hard time dealing with, and mostly or many times the medical system does not solve, just maybe a little bit subside with medication, but does not solve. So they come for pain and for stress.
Right, so they're sort of seeking, as opposed to treating the symptom, which might be the pain, or the pain being caused by the stress, you're looking more for the source, and by realigning these things that you find, the energies.
Trying to find the root of the problem. But of course, for instance, when we talk about stress, it could be stress can affect the body in many ways. It could be manifest as a physical problem that was a long time ago started with stress. So the goal is to treat the symptoms, to try to understand the root, and also bring awareness to the patient for what's the process that's going on in their body and why did they reach that stage, and not maybe try to heal that before. You know, as the Chinese say, don't start digging a well when you're thirsty.
Right.
So you want to gauge, you want to have the ability to feel your body, to see what's going on inside, and when there is a problem or there's some feeling of uncomfortable, try to understand where it's coming from, and use the tools that you acquired in your life in order to rectify that. And when I say tools, I mean, for instance, meditation, for instance, qigong, for instance, exercise, gym, stretches. You know, many people exercise and do nutrition. And so we have a lot of tools actually in our traditions as human beings, but many of them are not being used nowadays.
Yes, they kind of get forgotten.
Yeah.
So is there anything specific that sort of drew you into, we'll call it manual therapy, working with your hands and working with people? Was there?
For sure. I think I felt like I have a calling, and I was working in computers for 5 years actually before that, and I didn't feel fulfilled, and I felt, you know, a lot of stress in my body, and I didn't know why, and I felt like that my life has to be more meaningful than that. Not to judge anybody that's doing that, it's fine, everybody's different. But for me, I felt that I need to do something else. And then I chose that. And through the process of treating other people, of course, you have to treat yourself.
Right.
And you can only take a person for awareness level only as much work you do on yourself. So it's always invigorating me to do more work on myself.
Right. So
Yeah.
it's sort of a give and take between you
Totally.
and the person
It's always
that
a
you're
learning
working with
process.
all the time.
The way I treat today in a year is going to be different. Of course, hopefully it's going to be better.
Yeah, of course.
But
Always
it
getting
is
better.
going to be different because there will be always a evolution, you know, hopefully.
Right.
Yeah.
What could your clients expect to feel sort of after the treatment as they leave and they're traveling home? Is there anything in particular that they might be feeling that's different?
For sure. First thing, of course, we have to consider the symptoms of the patient. The symptoms has to change, or else they're not going to come back.
Right.
Of course, you can say, okay, this problem is going to take 5 sessions until it's going to change, or it's going to take some while. Depends on how long was the problem there. But another thing, the patient will feel a sense of expansion, a sense of well-being, a sense of maybe being closer to the way they were born, you know, to being closer to their body. There will be less disconnection from how they feel. Sometimes it takes a bit of time for patient to integrate what's happening, you know, on an awareness level, or sometimes things are being released and takes a while to integrate until he's ready for the next session.
Right. So
Yeah.
I'm looking forward to watching you do a treatment here. All right. Well, coming up after the break, we're going to be at the table with Nir, and he's going to take us through what a shiatsu treatment might look like. So you're watching Massage Matters on Community Connections, only on Rogers TV. Please stay tuned. All right, we're back and we're at the table with Nir. All right, Nir, so maybe you could just take us through what a sort of a typical, I know it's a shortened time, but just a typical assessment sort of treatment you might do.
Okay, so we're looking at shiatsu, Zen shiatsu or Shinso shiatsu. So first of all, in Japanese medicine, there's a concept that's called jaki. Ever heard of it?
No, never heard of jaki before.
Interesting, huh?
Yeah?
It's a weird name.
Yeah?
Jaki is a kind of energy or a kind of key that gets stuck in the meridian, in the aura, or in the organs.
Okay.
And in order to treat properly, I need to clear that energy.
Right.
And the way I do it, I use a medical qigong. Ever heard of qigong?
Qigong, yes, I'm familiar
Okay.
with Qigong, yes.
So qigong is means cultivating our own qi or ki in Japanese.
Oh, okay, I didn't know that.
So the same thing you can do and affect other people's ki. If they have a stagnation or something is blocked, you can help them integrate or clear that energy.
Nice.
Yeah, so just a very simple qigong exercise that clears the aura. Another concept I should touch on is in Shiatsu Shiatsu, there's a way to diagnose with a finger test.
Nice.
Ever heard of that?
No, I've never heard of that either, no.
All the weird stuff here.
Yes,
Happening
it's
now.
good.
Yeah, so finger test was actually is a Japanese technique. It's a little bit similar to muscle testing. Ever heard of that?
Yes, I've heard muscle
Okay,
testing,
that's
yes,
good.
but never just
So
through the
not
fingers, so
that
that's
much
cool.
out there.
Very
Yeah,
cool.
so muscle testing, for instance, the theory is that the whole body is affected by a substance that we touch, for instance. For instance, if I touch a cigarette, there's a good chance that the strength of my muscle will be just a little bit less. So for instance, I can hold a cigarette and somebody is going to try and lower my arm,
Right.
and I will be a little bit weaker than if I hold, let's say, an orange. Okay,
Right.
so similar thing, just without touch.
Okay.
So we have energy fields around our body, and our energy fields have an interaction. Okay, So potentially I can read my patient's energy field in relation to the meridian system.
Right.
Okay? And the way I do that is, first of all, I clear that energy, that Jackie, from the aura of the patient, so I don't have what they call disturbances. So I know I'm actually reading the meridian energy and not something else that's stuck on the aura.
Excellent.
And then I'm reading the energy with different sounds or different images that were devised by the teacher that developed this system, Shinso Shiatsu. His name is Ted Saito. He's considered the father of Shiatsu of Canada, in Canada, and he's around 70 years old now. Okay. He's the first guy that did Shiatsu in Canada. He's also a part of a lineage that from Shizoto Masunaga, which is like the guy that developed the Meridian Shiatsu. So very respectful guy. Yes. Very authentic teachings. Mm-hmm. And so part of the teaching is using the finger test to diagnose. So what do? I use I rub my fingers, and this area I connect to my hara. Another new concept. Hara is it means the lower abdomen. It's also the center of energy in Asian culture. Okay. So for instance, all the martial arts, they move from the hara, especially in Japan. The tea ceremony is from the hara, and the Zen paintings is from the hara. Okay. The martial arts from the hara. Everything is there. It's very big in the Japanese culture.
Okay.
Okay. So now that we have a few basic concepts,
yes,
we can start.
Sure. Yeah. Okay.
Okay. So first thing, I'm going to clear the energy of the patient. So I clear the Jackie from the aura. So I rub my fingers and I use a set of sound, and I get sticky or smooth. Whenever I get smooth, it means I have a positive reaction, which means I have Jackie stuck in the aura. So let's see where she has it. So I'm start to feel here. I start to feel sticky, and then it covers all the way up here. So usually the Jackie climbs from the feet up. Okay, so I'm just going to clear. So what I do is I use my intention and I use my aura to move the Jackie in a certain technique, which I won't go into detail now. I know it sounds a bit weird, looks a bit weird, but works. And with time, we practitioners start to sense all these things. The itchy energy. I'm sure you've noticed some itchy energy from your patients sometimes.
Yes. Yeah, for sure.
Yeah. So this is a way to clear that from the aura, and then we are able to go deeper into the meridian system. Sometimes in the first treatment, it takes a while to clear it. After a few treatments, it's quite easy. So this time actually clearing quite nicely. Not too bad. All right. So now we have the aura cleared. Now we can look into the meridians. So in Japanese, in Shiatsu, the reflex for the meridians are in the abdomen. There's a certain arrangement that we can diagnose. So I can do the same with the finger test. Check which reflex areas are positive, and then I would treat the meridians that lead into those areas in order to clear them.
Nice. Yep. Okay.
So the meridians, they flow. The meridians, if anybody doesn't know, the concept meridian is a French word, and it means energy channel. Yeah? Okay. And they flow, according to Chinese medicine, all over the body. And there are 12 of them, according to Chinese medicine. And there's 60 in the arms and 60 in the legs. Okay, let's do some work.
Yes.
Anyways, so first of all, I'm asking the patient, do you have any main complaint, anything that's bothering you today?
My hip's a little sore.
Your hip?
And yeah, my neck's always a bit sore.
Okay. So let's check the range of motion in the hips. So I'm going to raise the leg, and I'm just going to lightly try and rotate. So how does this feel? Okay, well, I see when I move that here, there's like a crank. Mm-hmm. Yeah? Yeah, hurts. Okay. So I can try and figure out, diagnosing the abdomen and figure out if there is any meridian involvement, or I can check the meridians that flow here and see if there is Jackie in any of them. Okay, so I pick up the spleen meridian. There's Jackie there.
Okay.
So I can already actually a little better. Okay. So diagnosis is also treatment many times. If your chi is strong enough, if you just diagnose, already some Jackie is moving. Okay, so now this is position for the spleen meridian, okay? Now let's check. Now I'm going to treat the spleen meridian. And each meridian has a sound, a certain sound that I use in my head, in my mind, and that vibrates with the meridian. So here, I feel pain in my hand. So I know Jackie is stuck here. I'm going to stay a bit more. So Shiatsu is, let's say, not the most exciting thing to watch, since it's a bit slow. But the main difference between shiatsu and oil massage is the use of the hara and the use of intention to move energy. So I'm using intention and my hara to go into the meridian and try to make it flow. Do you have any sensations, by the way, when I do that?
Yeah, sometimes I can feel a little bit of warming.
A little bit of warming, okay. And how hard am I pressing?
Pretty gently.
Pretty gently, okay.
So it's very gentle.
Yeah,
Yeah.
so you can do
Sort of pressure.
Yeah, you can do shiatsu hard or gentle, depends on how you do it. This style, Shinso shiatsu, is more energetic. So you go into the meridian, but you use more your chi or an intention to move the area, the jaki out.
And how long do your treatments usually last there, Nir?
Usually an hour 15, I would say.
Okay,
so
75 minutes, yeah?
yes. So how does this feel, by the way?
Better than it did.
Better than it did,
Yeah.
okay? So simple, but
Yeah.
yes, yet already affecting. So when I do that, I also feel here.
Yeah.
I feel tight on the lateral. Am I right?
Yeah.
Okay, okay. So let's maybe put you on your side and treat your side, because this meridian seems to be a bit tight. So let's see how we do that.
All right.
Okay. All right. Maybe this leg will take here. Okay. So just because she's here in this comfortable position, I'm going to treat also this area and also the same area, the same body part that she had pain in. So here we have the 3 yin meridian, the 3 main yin meridian that are very important for our health, and they are spleen, liver, and kidney. And also the technique changes according to the feeling. So for instance, here I feel more stringy sensation under my palm, and it's more tight. So I can go a bit faster because this will be more considered excess. If I feel a lack of elasticity or more weakness, I will go slower.
So what could your patients expect to feel after a treatment's all done?
So first of all, on the physical level, I'm creating an ischemic compression. And that so I'm taking the blood out of the area, and then I lay off, and then the blood comes back. So that creates a better blood flow, better lymph flow. Also relaxation of muscles. On the meridian level, or on the Asian perspective, I clear the meridians from this energy jaki, and they flow better, and so the person would have more energy, will be more relaxed. If there are symptoms of chi stagnation, of pain, usually that can help that. Also, if there are any stress or anything that's related to psycho-emotional stuff, that will help that as well.
All right. Well, that's fantastic there, Nir. Coming up after the break, I'm going to be taking you through some stretches for your shoulders, so you don't want to miss that. So stay tuned to Massage Matters on Community Connection, only on Rogers TV. One area of the body that is constantly overworked is our shoulders. One of the simplest ways to stretch your shoulders is to sit yourself in a nice upright position. And what you want to do is place your left hand on your right shoulder and your right hand on your left shoulder. And then you're just going to simply, very simply, just bend forward. You can do this sitting at home in a chair. You can do this at the office, at your computer. Now the goal is eventually to sort of get your head right down to your knees, okay? You can hold this for 30 to 45 seconds. I always want to remember that as soon as you feel a pull, if you're doing it and you feel a pull here, just stop until you don't feel a pull anymore before you go any further. Always remember to do some nice deep breathing while you're doing this one as well. You can do it a couple of times throughout the day. Another stretch that you can do for your shoulders is just bringing your arm across. Some of you have seen these stretches before, but it's always good to have a memory. Just cross it across your chest. Just nice deep breathing, just relax. And then always do the other side as well. Stretching, just sitting with your shoulders straight, just bring your arm across, all right? Always be gentle with yourself, okay? Nothing should ever hurt. Always going to that point of where you just feel the pull and waiting for that to relax, and then you'll stretch a little bit further, okay? Stretching should never hurt. Should never hurt at all. And what I want you to always remember is that you're experiencing any pain just to stop immediately. You should feel a stretch, not pain. I want you to remember that you should consult a health professional before you attempt to make a dramatic shift in your activity level. If you decide you want to run a half marathon or a marathon, make sure you talk to somebody before you attempt that. And always take it easy when you're starting a stretching routine and going through your stretches. Today I'd like to talk to you about TED.com. That's TED.com. If you've never heard of this site or gone to this site, I'm going to recommend that you do. TED stands for Technology, Entertainment, and Design. But since it was conceived in 1984, it's branched out substantially with the topics that they discuss. There's something for everyone on this website. The list of presenters and topics is far too great for me to discuss right now. But rest assured, you'll learn something you didn't know every time you watch a TED presenter speak, even if you feel you have a great understanding of the topic being discussed. One of the other wonderful things about the presentations is the time frame. The talks are usually limited to 18 minutes or less. This allows for a great deal of information to be given without taking up a whole lot of time for those who are watching. The main objective of the project is ideas worth spreading. Although the list of presenters and topics is long, let me give you some examples. Conductor Benjamin Zander has two infectious passions: classical music and helping us realize our untapped love for it, and by extension, our untapped love for all new possibilities, new experiences, and new connections. His talk centers on music and how it affects the listener. He uses his piano to teach us about ourselves. He says during the talk, "The conductor of an orchestra doesn't make a sound. He depends, for his power, on his ability to make other people powerful." Author Susan Cain gives a wonderful talk about introverts, those people in society who have and continue to make great contributions on all levels, quietly under the radar. Some of the more famous are Einstein, Edison, Rosa Parks, and Gandhi. These folks were all introverts who made a lasting impact on our world. She says of these folks, all these people describe themselves as quiet and soft-spoken and even shy. And they all took the spotlight, even though every bone in their body was telling them not to. The talk she gave has been viewed over 2.5 million times. And if I were going to recommend one video that will really impact you, it's Chef Jamie Oliver's talk, Teach Every Child About Food. It's an awesome presentation, one that I think you should share with your entire family. Remember, you're never too young or too old to gain more knowledge. The more times you go around the sun, the brighter you should become. I encourage you to go to www.ted.com and watch at least one video a day for the next 30 days. There's no telling what you will learn, and it's definitely a fantastic way to massage your mind. Well, that's all the time we have for today's show. I want to thank my guest today, Nir Saar, and our volunteer, Cindy. It was wonderful to have them here. If you'd like to find out more about Nir and the services he offers, you can go to his website at www.zen-needle.ca. I want to thank all the volunteers here at Rogers who have made this show possible. I want to thank you for watching. I hope you learned something new. I also hope you will take some time to give us some feedback about today's show by emailing your comments to massagematters@rogers.com. If you'd like to find out more about Shiatsu, you can go to www.shiatsucanada.com or www.shiatsuassociation.com. Please take me up on my suggestion of watching one TED presentation a day for the next 30 days. You'll be glad you did. Please join me for our next episode of Massage Matters, which will be all about contemporary acupuncture. I'm looking forward to it, and I hope you are too. You've been watching Massage Matters on Community Connection, only on Rogers TV. We'll see you next time.